And, you know, I think things like the vitamin D story is very odd, because the hospital where I work at, we've got a large Indian subcontinent population, and we've had a lot of vitamin D deficiency related to, you know, living in a northern sunless climate. And the one of the cardiologists there, they did a study very early on in March, April 2020. Everybody coming in with COVID was getting their vitamin D levels measured, and they then looked at what happened to people by their vitamin D level, and whether they landed up just staying on the ward and going home, or whether they landed up needing oxygen or going into intensive care or dying. And there was a very clear relationship that the lower your vitamin D, the worse you did. And the people with vitamin D levels over about 50 nanograms per mil were fine, and there haven't been deaths if you've got a high vitamin D level. Now, why did our local authority then not go rushing out to sort of push this? It's cheap as anything. You can buy 180, you know, tablets, 3 months supply in a supermarket for less than you could go and buy a cappuccino from a coffee shop. But we never have pushed it, and the NICE guidance, even now, still has the dose, which I was taught as a medical student for bone health, for stopping you getting rickets. But it doesn't have the proper dose that we now know is related to immune function. And T-cell function is dependent on good vitamin D. And that would have been such an easy thing to do in that first summer, get people out. You know, all this hiding indoors, we should have been out and about, getting the sunshine, going for long country walks rather than being told you can only go out for an hour. And we should have been really pushing people to take vitamin D supplements as they came into the autumn of 2020, so that, okay, we maybe were ill prepared for the first wave, but come the second wave, there was lots more could have been done to reduce deaths, I think.
And there was just no focus on things like vitamin D, vitamin C, zinc, exercise, losing weight, controlling blood pressure, controlling diabetes, all of these things that optimise the efficiency of the immune system. It all seemed to be, no, you need the vaccine. I never heard Chris Whitty talking about any of these things as far as I can remember.
No. Well, I mean, I think you look at Anthony Fauci in the States, who's run their National Institutes of Health for the last, 40 plus years. And during his time in office, someone was pointing out that the American public, I'm afraid, have become less and less healthy. And I think we're not far behind. And it is sad, because I think anything to do with general health would have not only improved your outcome for COVID, but would have improved your outcome for lots of other diseases too. You know, every winter, people who are dying of respiratory viruses are people who are more frail, or, you know, and you're at higher risk if you're diabetic, etc. Diabetes, type 2 diabetes, is a preventable disease, but we don't prevent it. We put people on treatment, and treatment that they can then take for years. And don't really tell them that if they lost 2 or 3 stone, they would lose their diabetes.